This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. With the goal of reducing door-to-room and door-to-physician times and patient elopements, learn how a team from Clair Hospital tackled these issues.
We knew that there was a problem, and it was very clear and very easy to identify. Dissatisfied patients, long waiting times, numerous patients leaving without even seeing a physician, and a very frustrated staff. A patient would arrive at the front door of the emergency department. Then they would typically have a seat in the waiting room. They would fill out a piece of paper with their name and some basic identifications and a reason why they were here. Then they would have a seat in the waiting room. They would then call the patient back to a triage room. At that point, they would get a full nursing assessment done. And once that paperwork was completed, they were typically asked to have a seat back in the waiting room. The patient would then be asked to go to the registrar, and their office was down the hall away. They would complete a registration process and be asked to have a seat in the waiting room again. Their paperwork would then go back to the back. It would be put into a queue, and that patient would then be waiting in the waiting room until they were called to the back. And then the charge nurse would take them back and put them in the room. Typically, they waited for the physician to come to the room, make an assessment, and then put orders into the system or let the nurse know that there was work to be done.
It's nice to meet you. Sorry you're not feeling so good.
Prior to our changes, our process improvement changes, it could take upwards of 80 minutes before a patient would even see a physician. The specific tools we used, utilizing the perfecting patient care principles, started with a process map.
Okay, we've got most of our current condition worked out, but I want to go back to that first moment and make sure we get all the steps right.
We actually walked the walk of the patient to truly understand what the current condition was. After we understood the current condition, we then could look for areas of opportunity. Now when a patient arrives, they approach the intake nurse. At that point, the intake nurse identifies the patient. An armband is generated immediately, simultaneously while getting the patient's weight, which is something we put into the system immediately so that if we have to give a critical medication, we've got an accurate weight. It's very important for patient safety.
The intake nurse or the intake tech will announce that there's a new patient that's going to a certain room.
New patient to room 31. New patient to room 31.
And then that cascades down through the different staff members that are in the back, and they respond back to the intake nurse.
Kirk available.
So that they know that there will be somebody there to greet the patient.
At that point, the patient is taken directly to a treatment room in the back. The nurse will mark that they're in the process of doing a triage assessment. The nurse then changes the status of the patient to provider to see status, which gives a blue flag indicator to our physician staff that they now have a patient that's ready to be seen. The physician then will use that same status board and change the status of the patient from provider to see, which was the blue flag, to treatment in progress.
Currently, if we see one or two patients in our waiting room, the entire staff gets nervous. Process improvement is basically essential to any business's operation.
Prior to our improvement, our door-to-room time averaged 54 minutes. After our improvement, we had that down to 18 minutes. Our door-to-physician time was 81 minutes. We got it down to 40 minutes. Our patients leaving without being seen averaged about 130 a month. After our improvement changes, we were 15. In April of this year, we went to the 95th percentile, or the top 5% patient satisfaction. And it looks like very soon we're going to be changing that sign to be the top 1% in patient satisfaction nationally.